This study evaluated the effects of utilizing a kiosk to teach job skills with parolees.
Integrating back into society can be a daunting task for many men and women whom are released from prison. Integration encompasses parole obligations, the need for financial security, including housing and employment, and establishing a support system. The need to actively develop and gain resources quickly following the release date is important for a successful integration back into society. The employment rates of individuals who were released from prison was 17.8% a week after release and increased to 43.4% after 2 months. Only after 6 months did the employment rate increase to 52.6%. These results suggest that less than half of the individuals released from prison found employment after 60 days. Public assistance has become a viable resource for individuals who are released from prison and are still looking for employment. The inability to gather resources quickly during reintegration has caused some individuals to believe that living in prison was easier than integrating back into society.
Immediately following a prisoner's release, an uphill battle occurs when trying to pay off their prisoner fines. Unfortunately, 25 to 30% of individuals who still do not have a job risk the possibility of returning to prison because they were not able to earn enough money in the time frame that was provided by the state. Recidivism is a large problem for individuals who are released from prison. In 2005, 89.3% of men who were released from prison reoffended, while 43.4% of those men reoffended within 1 year of their release. Correlations have emerged within literature to describe a possible relationship between offenders and recidivism. Lack of social relationships and support has emerged as one of the leading causes of recidivism for individuals who are recently released from prison. When former ex-offenders begin reintegrating into society and rebuilding their life, employment can be used to combat the possibility of recidivism. Although it has been indicated that employment is beneficial in reducing recidivism, former prisoners struggle with finding employment once they are released. Another struggle that former prisoners have is finding an employer that will hire them with their prior felony. Having a criminal record has been shown to have adverse consequences on employment. Due to the employers viewing them as security risks, the length of incarceration is correlated with employment prospects, specifically if an individual is incarcerated for longer than 6 months. Their employment options begin to decrease.
Prisons and reintegration programs have been utilizing computerized kiosks. Rarick and Randall reported that JobView LLC created a product called JobView Second Chance that provides inmates access to a national database of jobs with no direct connection to the internet. While kiosks are being used and implemented for various activities, little research has been conducted on their effectiveness within prisons or probation offices.
The present study extended previous literature on kiosks in practice. The purpose of the study was to evaluate the effectiveness of a kiosk to teach job search skills to parolees and decreasing the duration of a job search utilizing the internet.
3 male parolees previously incarcerated at a medium-security men's penitentiary in southern Illinois were selected to participate in the following study. The parolees were selected based on their current release from prison, their age, conviction, and prison sentence of more than 5 years. All sessions were conducted at a local parole office in southern Illinois, and 7 materials were required.
Trained observers recorded the duration of job search efficacy, which was defined as the participant using a laptop computer to successfully find one current job listing on an internet website. The duration of the target behavior measured the minutes from when the participant's hand was first placed on the laptop computer to the bell being rang by the participant when a job was found. Data was collected by the parole officer and a third-party observer located behind a one-way mirror.
2 observers recorded the duration of the target behavior to get IOA. Procedural reliability was assessed by a third-party observer who monitored the parole officer and participants' actions in regard to the intervention's requirements.
A changing criterion was used to evaluate the effectiveness of the Quick Skills kiosk. Sessions were conducted 3 times a week during various times throughout the day. Diffusion of treatment was controlled for by having all the participants attend their sessions at the parole office at different times of the day, and they were informed that searching for a job on the internet outside of the scheduled session was prohibited.
Prior to intervention, participants were selected from the inclusion criteria previously stated. Each participant was required to sign a consent form and a contingency contract. Each participant had scheduled parole officer meetings, which were scheduled with enough time in between each to ensure that participants would not interact with one another.
The normal meeting agenda was conducted for the first part of the allotted meeting time, and each participant was then able to search for a job. No instructions were given from the parole officer. The duration of time to search for a job was recorded by both observers. Taylor remained in baseline for 3 sessions, Dominic remained in baseline for 6 sessions, and Samuel remained in baseline for 5 sessions. The baseline phase ended when the phase was stable.
The normal meeting agenda was conducted for the first part of the allotted meeting time. Each participant was then using the Quick Skills kiosk to learn job search skills. This included 3 modules and a 15-question quiz. Each participant then searched for jobs similar to the baseline. The parole officer checked on the participant every 15 minutes. The duration of time to search for a job was recorded by both observers. Each time the participant attained the duration criterion, 50% of the previous baseline divided by the criterion, a Visa prepaid card was awarded. This process continued until 4 decreasing criterions were met.
Social validity surveys were completed by each of the participants following the termination of the study.
During baseline, Taylor had a mean of 183 minutes, ranging from 180 to 185 minutes. He also had a stable trend throughout. Dominic's mean baseline was 108 minutes, ranging from 80 minutes to 125 minutes. The trend for Dominic during baseline was variable, decreasing trend, and then increasing until stability.
Samuel had a mean of 93 minutes, a range between 80 and 90 minutes, and then his trend was variable, decreasing and then increasing until stability.
During intervention, Taylor had an immediate decrease in latency of change and severe decrease in level from baseline intervention. Sessions were stable around each criterion change. The decreasing level between each criterion shift was moderate with a range of 32 minutes to 7 minutes.
Dominic had an immediate decrease in latency of change and a severe decrease in level from baseline to intervention. Stability was reached from each criterion shift, and each criterion shift was a moderate decrease in regards to level, ranging from 32 minutes to 7 minutes.
Samuel had an immediate decrease in latency of change from baseline to intervention, a large decrease in level from baseline to intervention, and a decrease in level between each criterion was moderate to low, ranging from 23 minutes to 6 minutes.
Social validity results were recorded for questions 1 through 7.
Results indicate that using a kiosk to teach job search skills effectively decreased the duration of time it took 3 male parolees to search for a job during scheduled appointments with their parole officer. All 3 participants decreased the duration of searching for a job within 7 weeks. A threat to construct validity was increased attention from baseline to intervention because the parole officer used a FT15 schedule to check on the participants during intervention. A threat to internal validity was diffusion of treatment because participants could search for jobs on the internet outside of the parole office even though they signed a contract saying they wouldn't.
Limitations included stringent participant criteria, only using male participants. There was no way to monitor each participant's action outside of the parole office, and each participant was not continuously monitored throughout the session.
Future research could include examining the differences in participants' job search duration when attention is given throughout the entire study, examining the differences in participants' job search duration in a different setting, being inclusive to all types of felonies, and considering using a screen monitoring system or a lockdown browser to control what websites the participants are accessing. These are our references that we used in our project.